Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of norepinephrine. Norepinephrine is a neurotransmitter. It is a catecholamine and it is an adrenergic drug. It affects the alpha 1 and beta 1 receptors. In therapeutic doses, the alpha 1 is mostly affected. What are the effects of norepinephrine on the cardiovascular system? Norepinephrine constricts all blood vessels, all blood beds, including the kidney, and it has alpha 1 effect, and it increases the peripheral resistance. So it is a vasoconstrictor in all the blood vessels, including the blood vessels in the kidney, and that is the alpha 1 effect. Norepinephrine increases both systolic and diastolic blood pressure. Norepinephrine induces reflex bradycardia with the vagus nerve baroreceptor association. So the baroreceptor reflex and norepinephrine does not increase the heart rate in life, but in isolated cardiac muscle, it may increase the rate of contraction. But in our life, norepinephrine does not increase the heart rate. It is due to increased vagal activity induced by baroreceptor mechanism. Baroreceptors are present in the bifurcation of the common carotid artery as well as at the arch of the aorta. So from there is some sensation that goes to the brain stem to maintain blood pressure. So that is carried by mostly by the vagus nerve and also glossopharyngeal nerve. Norepinephrine does not increase the heart rate, but it is due to the increased vagal activity induced by baroreceptor mechanism. There's the reason it does not increases the heart rate. Rather, it causes reflex bradycardia, decreased heart rate. Norepinephrine increases the force of contraction. So it is inotropic but not chronotropic. It increases the force of contraction of the cardiac muscle, so it is inotropic. It does not increase the rate of the heart, so it is not chronotropic. If atropine is administered before norepinephrine, heart rate will be increased by norepinephrine. Because in that situation, vagus nerve and baroreceptor reflex is not working. So the norepinephrine will increase the heart rate. But in our life, the norepinephrine causes reflex bradycardia in association with vagal activity and the baroreceptor mechanism. What are the therapeutic uses of norepinephrine? Norepinephrine used to manage shock, especially vasodilatory shock like that of the septic shock, because norepinephrine increases blood pressure and the peripheral resistance. It constricts all the blood vessels. It increases both systolic and diastolic blood pressure. So therapeutic use is shock, especially vasodilatory and septic shock. Okay, here's some clinical notes. Norepinephrine is never used for asthma because it has very poor beta 2 activity. So it will not cause bronchodilation. So it is not used for asthma. But epinephrine is used for asthma, not the norepinephrine. Norepinephrine induces reflex bradycardia, as we explained, by the activity of vagus nerve and the baroreceptor mechanism. Norepinephrine increases both systolic and diastolic blood pressure, but epinephrine increases systolic blood pressure but decreases the diastolic blood pressure. So these are the differences between the action of norepinephrine and epinephrine. Epinephrine increases systolic blood pressure, norepinephrine increases both systolic and diastolic blood pressure. Norepinephrine for both, but epinephrine decreases the diastolic blood pressure. Epinephrine decreases peripheral resistance. That's why it decreases diastolic blood pressure. Norepinephrine increases peripheral resistance. So these are the differences between norepinephrine and epinephrine. We have another drug, metraminol, is favored over norepinephrine for shock management because metraminol does not decrease renal blood flow. So this is a sympathomimetic drug used in shock. It has some advantage over norepinephrine because it does not decrease renal blood flow. Okay, and that's all about pharmacology of the norepinephrine. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.